Do have a major development on the COVID vaccine. More than 2 million healthcare workers across our state will soon be required to be fully vaccinated. This is completely different from what was initially said by Governor Newsom.
Right, a lot of back and forth here. News 8's Chris Grow live, and Curdy Mason now with more on this mandate. Good morning, Chris.
Yeah, truly a mandate now, because at first there was an actual choice. Get vaccinated, show proof of your already existing vaccination, or submit to weekly testing. However, this time around, it is simply get vaccinated. And that deadline for the time in which healthcare workers have to get vaccinated coming up pretty soon. 2.2 million healthcare workers have to be vaccinated by the end of September. Now, there are two exceptions: religious reasons and a qualifying medical reason. But that qualifying medical reason needs to have a note from a licensed physician, a doctor essentially, right? So behind the change is the surge of new COVID-19 cases, even from when Governor Gavin Newsom first announced the vaccine requirements for state workers and healthcare workers. There's been that surge, right, of COVID-19 cases across the state amidst the rise of the Delta variant. Now, the CEO of Scripps Health, we spoke with him about this crisis as well as the vaccine mandate. His name is Chris Van Gorder, and he says that this is the right move for California.
As a society, we have a responsibility to ourselves, but we have a responsibility to our colleagues, our community members, and others. And even though you may not be vulnerable, there may be a lot of people that you're interacting with that are vulnerable.
The state also issued a new mandate for long-term health care facilities, senior health care facilities. Basically, anybody that comes indoors for a visit must be vaccinated, so show proof of vaccination, or have a negative COVID test within the past 72 hours. Eric and Stella?